Good afternoon and welcome to the March 30th Community Update. My name is Stacy Wood and I'm a Public Information Officer here for Buncombe County Health and Human Services. Today we have Stacy Saunders, the Buncombe County Public Health Director, here with us to provide an update on the COVID-19 response in Buncombe County. As a reminder, this update can be found in real-time Spanish on Facebook, and that can be found at Buncombe County's Facebook page at BCHHS. And we'll go ahead and get started with an update from Stacy Saunders.
Hello and good afternoon, everyone. Thanks so much for joining us today. I first want to acknowledge that today is National Doctors Day and take a moment to show appreciation to our area doctors who have been hand in hand with public health throughout our COVID response. And especially, I would like to recognize our medical director, Dr. Jennifer Mullendore, for her commitment and service to public health as she continues to be an important force in our fight against COVID-19. Let's get right into the numbers. As of today, we have identified 16,409 confirmed cases of COVID-19 in Buncombe County. 301 COVID-19 related deaths have occurred in our community. We are seeing about 27 new cases per day enter our public health workflow. This is a decline from 32 new cases last week. In terms of the metrics that we monitor weekly from Monday to Monday, our new cases per 100,000 per week is 75. This is roughly a 14% decrease from the week prior. Overall, the epi curve continues to show some plateauing or slowing in the decline of new cases. The percent positivity remains below 5%, but has increased to 4% as of today. Last week, this indicator was hovering around 3.6% on average. As I said last week, the plateauing or lack of continued decrease in new cases and now an increase in percent positivity, albeit still below 5%, is of concern. We are seeing upticks in cases in other states. We continue to see variants of this virus circulating in our nation and our state. I cannot stress enough the importance of each of us doing our part to stop the spread. Continue to make healthy choices for you and those you love by maintaining distance between you and others, wear your masks, and wash your hands. Our successes so far are still so fragile. We must stay diligent and confident in the 3 W's until more of our neighbors are vaccinated. As I said last week, we are most effective in reducing the spread of disease when we layer our approaches, like the 3 W's, testing and tracing, and vaccination all working together, versus just relying on one intervention. If you are sick or think that you have been exposed to COVID-19, please utilize community testing services. Timely testing allows us to identify sources of potential spread before others may be exposed. You can find a testing location near you at Find My Testing Location website, which includes local urgent cares and pharmacies, or visit starmed.care to make an appointment for the AB Tech testing site. And when you get your vaccine that is available to you, you will be part of a vital strategy to end this pandemic and begin to return to some normalcy in our county, our cities, and our neighborhoods. The vaccine is safe, effective, and it is proven to be a powerful defense against severe illness and death due to COVID-19. Beginning tomorrow, March 31st, the remaining individuals in Group 4B will be eligible for vaccine. This group includes other essential workers and those living in other group living settings that have not already been vaccinated. Through a combination of efforts by our Public Health Ready team and our IT department, we have worked through the remainder of our wait list. We accomplished this through a few ways. Waitlist clients have received an email, text, and phone call that an appointment is available to them through an online scheduler. Waitlist clients also received a message that they can call the Ready team for an appointment. And waitlist clients will get an additional reminder by the end of the week about an appointment being ready for them. With the opening of Group 4B on Wednesday, March 31st, the process for scheduling a COVID-19 vaccine will transition to a self-scheduling process where those who would like to schedule an appointment for a Buncombe County HHS vaccine site can do so online at buncombeready.org or by calling the Ready team at 828-419-0095. Those who are eligible can schedule appointments 24/7 through either of these methods at their convenience. Those interested in a vaccine can also locate a vaccine provider near them by checking out myspot.nc.gov. There are several vaccine providers listed on the site in our area. Our weekly baseline allocation continues to be 3,510. This baseline allocation is intended for general population within the eligible groups. In addition, Buncombe County HHS is receiving 300 doses for equity purposes. Next week, we will be working with the Mexican consulate to utilize those equity doses for the Latinx population within our community. With the 400 doses we accepted last week from our hospital partner, we were able to vaccinate over 180 individuals at our local detention center and over 200 individuals at our Haywood Street Congregation outreach event. This week, Buncombe County HHS will be accepting 1,170 additional doses to be transferred to our partner at Ingles grocery stores for use throughout the community in their pharmacies. This approach is allowing us to place vaccine throughout the community for better geographic distribution. As you may be aware, North Carolina Department of Health and Human Services added vaccination data to their dashboard that allows providers and public to see not only state data, but also county level data. The North Carolina Department of Health and Human Services dashboard is now not only showing those doses administered through North Carolina state allocations, but also has a filter to see federal doses administered, as well as an all provider doses administered, both state and federal. As of yesterday, about 4.7 million total doses of vaccine have been administered in North Carolina through state and federally enrolled providers. In Buncombe County, 136,259 total doses of vaccine have been administered through state and federal enrolled providers. This means 33.3% of the total Buncombe County population has been at least partially vaccinated, and almost 19% of the county population has been fully vaccinated. As of today, Buncombe County HHS and our partners in emergency management have administered 58,707 total vaccine doses. 59% of these are first doses, and 41% of these are second or single dose vaccinations. Total doses coming to the community has increased from a couple thousand in our first few weeks of vaccine rollout to now almost 8,700 doses a week to state-allocated providers in our community. This is in addition to the federally allocated providers like Walgreens, who are also receiving doses each week. Access and opportunity to vaccine grows as more and more vaccine providers have been added and are receiving allocations, either from the state, directly from the federal government, or through local transfers. If you are in one of the currently eligible groups and are interested in receiving your vaccine, again, please check out myspot.nc.gov to find a vaccine provider in your area. If you are not sure what vaccine group you are in, please visit findmygroup.nc.gov to learn more. And just as a reminder, you may receive your first dose at any location, and it is important for you to return to that provider for your second dose. All second doses are sent based on first dose allocation and administration. Your first dose provider will have your second dose. And in closing, I know this continues to be a long fight. It is not quite over yet, and I'm asking you to continue to help me and our public health warriors to stop the spread of COVID-19. Please be diligent and committed to all the precautions. It is still incredibly important to wear your mask, keep your distance, and wash your hands when you are with folks who are outside your household and in public spaces. Remember to get tested if you are having symptoms or think you may have been exposed to the virus. Finding new cases as quickly as possible is very important to reducing the spread of COVID-19 as we continue to roll out vaccine throughout our country, our state, and our county. And lastly, get your vaccine when it's available to you. With more vaccine providers on board in our community, there is more opportunity to get a spot for your shot. We can stop COVID-19 by using this three-pronged approach of testing and tracing, using precautions, and getting our vaccine when it's available to us. Thank you so much for your time and attention. Take care of yourselves, and please be safe.
Thank you for joining us for the community update. Please visit buncombeready.org for information on the COVID-19 response in Buncombe County. Thank you.